Welcome to the First Nations Health Managers Association's weekly town hall. Over the next hour, we will provide an update on the COVID-19 pandemic and then focus on what we can do to close the 87,500-hour life expectancy gap. Join us as we speak with health professionals, subject matter experts, and Indigenous leaders. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crow.
Tansay, broadcasting live from the territories of Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, and many other diverse nations. And we are coming to you from Takaronto, Toronto, Ontario, in the studio of our partners, NationTalk. As mentioned, I'm Marion Crow. I am your host for the First Nations Health Managers Association weekly town hall. Thank you so much for letting us come into your territories, nations, organizations, and homes, where we bring you credible, reliable information, not just on COVID-19, but Indigenous health. We are here to give you back hours. We live approximately 87,500 hours less than the rest of Canadians. So how do we get back our time and close those gaps? We're here to unpack that for you. And if you have a question for any of our guests, you can send those questions to FNHMA@ihtoday.ca. Today, we want to talk to you about sleep apnea and sleep disorders. It is not gonna be a snoozer though, I promise you. You are gonna find some very valuable information here on the FNHMA Town Hall. It is such a pleasure to have our all Indigenous men panel today. How about that? The men are representing, and it is my pleasure to sit with all of these handsome gentlemen. The first up is Dr. Evan Adams. Dr. Adams, come on into the crow's nest.
Hi, Marion. So nice to see you. I agree. I wish there were more women here taking care of each other. Often there are women there, and I'm so glad to be able to talk about health because, of course, that's my work, and I quite love it. I quite love being with our people and talking about different ways that they can take care. But I think my job today is to give you a COVID update, right? And then I'm going to hang around for your discussion around sleep disorders and sleep apnea. So, Ajishwit, I'm Dr. Evan Adams. I'm calling in from Tla'amin Territory, which is very close to what is now Vancouver. And COVID is with us, though it's ever changing. I think most of us are pretty relieved that there have been some changes for the good, as in there seem to be fewer cases than there have been in the last little while. So, for instance, the number of communities of concern, like number of First Nations communities in the provinces with more than 10 cases of COVID has dropped from last week, from 67 communities to 63. And the reason I again talk about First Nations communities in the provinces is because we're not good at counting Inuit. We're not good at counting the Inuit in the north, in the Northern Territories, and only a few provinces have the capacity to count Métis and Métis COVID cases. So the number of communities of concern, dropped to 63. 2 weeks ago, it was 90 communities of concern. There were no new deaths reported over the weekend amongst First Nations people across the country. Amazing. 6 new hospitalizations, but none in the territories. And so this is all good news, but I'm going to talk about the quality of the data in a sec. And as of March 21st, in First Nations communities on reserve, we're aware of 2,374 active cases. And that's down more than 300 cases from 2 weeks ago. So we have 300 fewer cases from 2 weeks ago. However, I should also say that official testing is down, as in people used to rely a lot on lab-based testing, which we could easily count, but now people are relying more on rapid antigen testing, and we're not so good at keeping track of positive results from rapid antigen testing that you do at home. So our official counts are down, and definitely other Canadians' COVID counts are down, but there's still cases, and of course, with public health measures easing up in many provinces and territories, we do expect that there will be more cases, as in these drops that we've been experiencing since the end of January, the peak of wave 4, will start to increase again, and hopefully won't increase too much. Yeah, so the number of active cases today from a few days ago decreased by 147 cases. So 147 cases less today than roughly yesterday. The number of communities with active cases has decreased from 196 to 190. There were 214 communities with active cases 2 weeks ago. So now we're down to 190 communities with active cases. And the total number of communities ever affected during the whole of the pandemic has increased by 2, for a total of 430 communities ever affected, and probably a community near you. You probably have stories about how that went for them. So everyone's talking about Omicron. Actually, maybe people aren't talking about Omicron anymore, as in it used to be a bright part of the news. We were all hoping for the ongoing good news that Omicron was relatively mild compared to Delta. And I should say that that is not quite true for some people. Some people can get Omicron and then have sequelae or long-term effects from their infection, and for them, it's definitely not mild. And the number of deaths and the number of hospitalizations is up because there were so many cases of Omicron, though a fewer percentage of those cases were serious cases. Hopefully that makes sense. So as far as our cumulative case rate, like compared to other Canadians, we're still 2.2 times more likely to have ever had COVID, 2.2 times higher or more likely to get COVID than other Canadians. And our active case rate, like how are we doing right now? We're still about 1.9 times higher than other Canadians. However, this is, and this has been the case for a while, our hospitalization rates and our case fatality rates are lower than that of other Canadians. So we are hospitalized at about 79% the rate of other Canadians, and we die at 64% the rate of other Canadians. And there are lots of supposition around that. But I won't go into that because I only have just a couple of minutes here with you, and maybe if you have some ideas, you can bring them up later. So yes, the lifting of public health measures, I think, is concerning for some of us. I'm definitely going to keep my mask on whenever I'm in public because I have parents who are in their 80s and older people, the elderly, who even if they're like triple vaccinated, like my parents, still have quite a high complication and fatality rate because they're so fragile. So we still have to protect them. I think some of my younger family members are definitely a little more social than they used to be, but I am definitely telling them, well, if you're going to be out and about without a mask, please don't hang out with Papa and Chichia. We are also continuing to see that a significant percentage of our First Nations cases are in children under the age of 19 and in women. And this has been consistent over a number of weeks, and we're not quite sure why. We're guessing perhaps because the social situation of our children, that they're going to school. Maybe there are more kids in a single house. Maybe our children are more social or connected to their cousins. Um, uh, Something like that. And maybe it's because they're often with female caregivers, that's perhaps why we're seeing more cases amongst children and women in First Nations, but it's just a guess. Definitely, we're seeing in all age groups that we have higher COVID rates compared to the general population. So I think I'm going to stop there, and I am going to wish you well with the next part of your show, and I'm actually quite looking forward to it.
Dr. Adams, thank you so much for being with us to continue providing that credible, reliable, and factual information here on the First Nations Health Managers Association Weekly Town Hall. Dr. Adams, I really appreciated a lot of what you just said. Ontario is just lifted the mask mandate yesterday. And as a fully vaccinated, boosted Indigenous woman with underlying health conditions and having just got over pneumonia, I too am going to continue to mask up. Not on the show, of course, but if you have not had the opportunity to go get your booster yet, please do so. My Kokum and Mushum and my elderly relatives, thank you for protecting us. On that note, let's come back to the topic at hand. I want to hear the patient perspective on going through a sleep apnea diagnosis. And with that, I do want to just set up this guest a little bit. This is a guest who doesn't like being in front of the camera like I do. No surprise there. This is somebody used to being behind the camera. And this is our partner, NationTalk. We have a pre-recorded video from Don Barraclough.
My name is Don Barraclough. I'm president and CEO of NationTalk and Indigenous Health Today. I'm a member of Peguis First Nation. It's one of the largest First Nations in Canada, and my grandparents grew up there. My mother was a 60s scoop. She ended up in Richmond Hill, Ontario, where I was born and raised. NationTalk is an Indigenous newswire service. We've provided over 300,000 opportunities since 2005. We deliver employment, press release, events, tenders, and we've recently started Indigenous Health Today at the beginning of the pandemic to share information about Indigenous people's health and well-being. So we've partnered with First Nations health managers for about 2 years now, doing COVID town halls live as well as broadcasted to APTN. We think it's been an excellent facilitator of information, credible information for Indigenous Canada. Well, we started off just talking about COVID-19 for the entire hour. Now we've moved into, now that COVID's kind of relaxing a little bit, we wanted to talk to you about other content. 87,500 hours is the life expectancy difference between Indigenous and non-Indigenous people in Canada. 87.5, I think if people look at it from that perspective, we'll say, what can we do for our families to increase their life expectancy, but not only the life expectancy, the quality of life for Indigenous peoples in Canada. And this show is to talk about those things. For example, today I'm talking to you about obstructive sleep apnea and sleep deprivation. It's a real thing. It started being looked at in 1986 A lot of doctors aren't aware of what it is or how it affects people's lives. How it affects people's lives, it can take off somewhere close to 6 to 7 years of your life expectancy if it's not dealt with early enough. I got diagnosed a little over 2 years ago. They did the sleep test, and I found out I was stopping breathing about 90 times an hour. That's 3 times what's considered severe sleep apnea. I was falling down at night when I'd go to the washroom. I'd sit on the edge of the bed and just fall over and hit my head on night tables. It was incredibly difficult to understand. By the time Friday came along in the week, I couldn't stay awake. My memory loss, apparently what I'm told is your REM is how you remember what you did earlier that day. 100% REM means you're going to remember just about everything. 10%, which is roughly where I was, means you'll remember very little. I remember doing meetings, one with Tuesday Johnson, an Indigenous entrepreneur, and we had breakfast. And at breakfast, we talked about her needs and what she's hoping for in terms of communications and marketing. And I'd go back to the office, and it was all gone. I just couldn't understand what was happening to me. You don't feel right in your skin. And this has gone on for decades. Apparently, I've never been able to sleep soundly. Difficulty breathing, just stop breathing in the middle of the night, and I was diagnosed with sleep apnea at 90 AHI. That's the apnea score they give you. 30 is considered severe. 90, you're stopping your sleep routine 90 times an hour. So every 45 seconds, I would be waking up or never really get to sleep. Did it affect my work? Absolutely. Did it affect my personal life? In every way. Your moods are all over the map. Your thoughts, your feelings. Later in life, it gets tougher. If I had been diagnosed when I was younger, life would have been so much easier. The quality of life I would have had would have been through the roof compared to struggling in business and with your staff and trying to keep up with people and the moves they're making and the changes you want to make to your company. The advances you want. We're in the IT business, which changes every day. It's a struggle when you're getting just a little bit of sleep every night. You first run on adrenaline. Your body tries to overcompensate. So your adrenaline is running, you're doing your business, you're trying to make change in the world, and then it just stops. Most of my life I've worked many more hours into the night just to get a decent day's work in. And then what happened, I guess about 2 years ago, because the longer it happens in your body, the more your body shuts down later in life. So you may have bad sleep habits, you may be snoring, you may be stopping to breathe, but it gets worse. It gets much worse. Your body can't take it anymore. You've only got so many heartbeats in your heart, so much electricity, and that's going to stop. And this is where I was heading. Yeah, so after being told to go to the sleep doctor and the sleep clinic and get diagnosed for years and years and years, and I just put it off and say it's not a problem with me. There's also a stigma associated with sleep apnea. It's, you know, you're overweight, you're a smoker, you're this, you're that. But I found out that Indigenous people are 80% more likely anatomically to have sleep apnea. That means our brothers, our sisters, our mothers, our fathers, our grandparents, they're all going through it. So you try running a company, try, communications, things are happening quickly, and your body's giving out on you, your mind's giving out on you, your memory's giving out on you. So that's why I'm here today. I want to talk to younger people and say, don't wait, don't hesitate, don't wait for things to get this bad before you try and go get help and not suffocate every night like I was doing. I was suffocating, I wasn't getting the air. I was getting 25% less oxygen to my brain every single night. And it just didn't have to happen. As Indigenous people, we have healthcare workers, we have people that care in our communities, we have health directors and nurses that can help you get diagnosed. Now, even doctors don't necessarily understand sleep apnea. It wasn't even recognized till about 1986. I believe we're having a doctor on later in the show that's going to talk about sleep deprivation and how that affects people. How it affects your mentality, your working process, your thinking process, and all those things. So go out and get tested. It's one night of your life, but it gives you back so much more. Not only will it give you back greater life expectancy, the quality of life. I can't begin to speak on the quality of life, the difference between not breathing at night and breathing. The colors are crisper, the sounds are amazing, the smells, like it's like watching a black and white television versus an HD crystal clear 4K television. That's the difference in your life. You're going to be able to enjoy more time with your family. So many more things. So that's why I say again, just get diagnosed. Get rid of the deprivation. They talk about so many things that affects weight gain, diabetes, heart disease. Your body can't heal without REM sleep. That's when your body heals, is at night. So if you've got a bad back or a heart disease or something like that, without sleep, it can't get better. That's why I'm here today.
And John, we are so happy that you are here today to share that very personal journey about your diagnosis with sleep apnea. There is a comment in the inbox encouraging Indigenous men to please be courageous and look after your health. It took so much courage for you to get in front of the camera and share that very personal journey with us. But I think that story might have just saved a life. Thank you, John. You know who else wants to contribute to saving lives and talking about this topic? It is our friend, Dr. Malcolm King. Dr. King, come in to the Crow's Nest and share the landscape of sleep apnea with us. Welcome, Dr. King.
Ani Chimigwech, it's a privilege to be with you today here on the Town Hall and NationTalk. I have the privilege of working as a researcher at the University of Saskatchewan with a team that includes health professionals, sleep experts, as well as Indigenous community participants that include band counselors, health directors, and knowledge holders, elders. I'd like to actually acknowledge the importance of the patient voice in research and action, and we just heard that from Don Barraclough. The voice of lived and living experience needs to be part of the planning and decision making. And I'd also like to similarly acknowledge the importance of health administrators because they need to be there from the beginning in the planning and decision making of research so that the research gets taken up and utilized. And together with the researchers and health professionals will be stronger. So I want to say a little bit about our research in Saskatchewan on sleep apnea and sleep disordered breathing. So it's taken place really in 3 phases, the first of which dealt with issues of respiratory health, not just sleep apnea, but other things such as chronic obstructive lung disease, asthma, and so on. But sleep disordered breathing and sleep apnea were certainly front and center in what we heard in our discussions with communities. And what the health professionals came to realize is that one of the major issues was access to diagnosis and treatment. And you've heard that in a way from Don. But for First Nations living on reserve in Saskatchewan, there was an extra health burden and inequity because they had less access, more difficult access to the diagnosis and treatment that was necessary to make a difference in their lives. And so that first phase of research, and I give a full credit to our lead researcher, Dr. James Dossman, and Greg Marshallton, a policy expert, they produced a paper that led to decisions being made that would improve access to diagnosis and treatment for First Nations, first of all in Saskatchewan, but then ultimately across Canada. The second phase of the research, and one that still continues, is exploring the extent of sleep disorders and their effects on health and wellness in Saskatchewan First Nations. So we've worked now for several years with 2 Cree First Nations in central Saskatchewan, slightly north. And I'm not naming them because it's up to the communities to name themselves. I'm a researcher, so I talk about University of Saskatchewan, but the communities have their own voice. But in any case, we've worked very well with these communities and come to realize that yes, indeed, sleep disorders are related to such important issues as body size and smoking, but they're also related to other factors such as the adequacy or inadequacy of housing and other issues, some social issues. And so we've produced some papers and also community presentations. They're both very important to illustrate these issues, not just to the communities, not just to the academic world, but to let other First Nations know about it as well. That part of the study continues to this day. There's another phase even planned for this upcoming summer season of getting people more diagnosed and into treatment. And as has already been said, if you feel like you're at risk for sleep disorders, and so many of us First Nations are, please go and get yourself tested, seek treatment. Treatment is there, the testing is there, but you need to be part of the solution. You need the self-determination yourself to go and get that testing and treatment. The third part of the research has just begun, and I mentioned housing as a factor in sleep disorders and deprivation. And this is something that the communities came to realize probably long before we researchers did. And I'm really proud of these two communities because they've taken it upon themselves to lead this third phase of research. The research on housing, what will make it better, what will improve the quality of life in these two First Nations in Saskatchewan, and hopefully provide guidance for other First Nations across Canada and in other parts of the Indigenous world. So this research has just gone on. I already mentioned self-determination. Self-determination is important not just for individuals to go and seek diagnosis and treatment, but self-determination for communities to take control of their health and wellness and find researchers to work with, not the other way around, researchers finding communities. So I'm very pleased to be a part of the team that's working on the issue of housing. So I will close maybe by mentioning that March 18th was World Sleep Day, and this is where the attention of the world turns to sleep disorders. But here in Canada and in First Nations territory, this is Sleep Week, and we look forward to further information and dialogue with First Nations on sleep disorders. So at that point, I think I will pass it back to our hostess. Chimigwech, thank you very much. Merci beaucoup.
Thank you so much, Dr. King, for setting the stage and informing us and our audience and everybody listening to Indigenous radio about the big picture of sleep apnea and that link to Indigenous communities. I have to say, you stole my line, by the way. World Sleep Day. We really need to think about how our sleep is impacting us every day. And I too will share. I've been diagnosed with CPAP or with sleep apnea as well, and wear a CPAP machine. Ladies, I'm here to tell you, if you do get diagnosed after you go get tested, don't worry. They're not all like Darth Vader masks and scary. You're not going to sound, funny. They're quiet. I have a machine that has nasal pillows. So it's just a little pillow under my nose with some straps around my ears to hold it in place. And I have to say, it changed my world getting that CPAP machine. And let's face it, it is so quiet, it's not intrusive, and the benefits, oh my goodness, I'm telling you, like Dawn said, it's like turning on a color TV. So I just wanted to share that with you, is that I too have sleep apnea, and very personal topic for myself. Before we go to our next guest, I do want to remind you that if you have a question or a comment, you can send those to FNHMA at ihtoday.ca. And folks are watching. Thank you, Gordon, Randy, Yvonne, Jordan, Samantha, Jonah, and Amy. You are getting your credible, reliable information here at the FNHMA Town Hall. Thank you for watching. Now it is time to bring in another pre-recorded message to all you folks, and that is a message from a family physician here in the Mississauga of the Credit Territory, Dr. Jeremy Resmovich. Before we bring his video up, though, I do want to say something about this family physician. An amazing ally to us, and how I remember him as a doctor who was joining the fight for masks at the beginning of COVID. His work and advocacy got millions of masks out to our communities when we needed them most. So affectionately, I call him Dr. Rez. I'm so proud that he decided to join us on the FNHMA Town Hall. Let's play the video from Dr. Rez.
Hi, my name is Dr. Jeremy Resmovich. I'm a family physician in Toronto and an assistant professor at the University of Toronto. I'm here today to talk to you about sleep apnea and why I think it's important. There are three main types of sleep apnea. There's obstructive sleep apnea, there's central sleep apnea, and then there's a mixed version. All of them present with very similar symptoms, but the first one happens to be more structural, and the second one happens to start more from your brain. It's a central problem. When I say structural, and we talk about obstructive sleep apnea, we're talking about the relaxation of muscles in your neck that make it difficult for you to bring air in and out while you're sleeping. Some of the symptoms that might show up with obstructive sleep apnea include snoring or gasping for air when you're breathing. You may have daytime fatigue, because if you're not sleeping, you can end up with a lot of fatigue during the day, and difficulty concentrating or memory issues. If you have central sleep apnea, then it's coming because of a lack of basically chemistry between the brain and the diaphragm and the ability to breathe. The problem with sleep apnea is that sleep is 1/3 of our life, and it is quite profound that it impacts the other 2/3 of our life so vastly. Not getting enough sleep can impact your brain, can impact your heart, can impact how we metabolize sugar in our body. It can lead to possible strokes, and it can lead to asthma and other respiratory issues. I think this is really important for the First Nations community, because we know that sleep apnea is 4 times more prevalent in First Nations community than in the rest of Canada. We know that sleep apnea is associated with many conditions like diabetes, heart disease, and anxiety and depression. And we know that when people are rooted in anxiety and depression and mood disorders, they try to use coping strategies in order to alleviate those feelings. A lot of the times people use maybe drugs, maybe alcohol, maybe food, and become addicted to these coping strategies because they're just surviving. They're really trying to survive and make it through their day. I would tell you, please go to the doctor. Tell them about your symptoms. Tell them you're concerned about my symptoms and that I'm stopping breathing at night. I'm really tired during the day. Ask for the blood panel. Make sure that there's nothing going on organically in your body. Make sure that it's not diabetes or your thyroid issue that's going on. Make sure you don't have potassium or sodium issues like metabolic issues. And again, this is for the doctor to decide, obviously, or the nurse practitioner. But the most important thing is to be able to be assessed for sleep apnea and rule out a reversible cause, because there are treatments that can help you. The next step after this would be an assessment. And assessments usually take place either in a sleep clinic or possibly at home with a portable sleep assessment tool. Once the diagnosis is made, there are machines that can help you, whether it's a CPAP machine, which stands for continuous positive air pressure, or a BiPAP machine, which just means that there's pressure going in both directions. Hopefully with that in place, and anecdotally I can tell you from a lot of my patients, people sleep better at night. And after they've slept better at night and there's more oxygen going to their brain, they feel more alert during the day. They feel like they can make better decisions. They feel like they have better concentration. They feel like they're more productive. My last message is to the patient, in that healthcare providers can't do this without you. If you do experience any of these symptoms, I recommend you following up with your healthcare provider and letting them know that you're having daytime fatigue, that you're having snoring at night, that you're gasping for air at night, and someone's witnessed that. And hopefully, with that information, they'll be able to assess you and say, you know what, I think it's time for you to have a sleep study. I think it's time to make sure that you don't have sleep apnea because it's so correctable.
It is correctable, folks. I encourage you all, if you are thinking you have any of those symptoms that our good friend Dr. Rez had suggested, it's time to go get tested. And you know what, health directors, listen up, because we have another guest wanting to share credible, reliable information on how to navigate that system of non-insured health benefits and all of the supports. And that is the best president, Mr. David McLaren, president of the First Nations Health Managers Association and health director at Kepua. Doctor, I'm giving you a brand new title.
No,
David,
thanks.
David McLaren, come on into the crow's nest.
Thank you, Marion. All the way from the territory of the unceded Algonquin people. So thank you very much for having me. This is obviously a subject I too have to heart, as I am a CPAP user, but I'll just start off with a quick anecdote. Maybe about 3-4 years ago, we're a couple of guys, maybe 6 of us, we were outside a refreshment tent at the end of our country fest on a Sunday afternoon, and we're talking. And all of a sudden, out of nowhere, the conversation turned to CPAP. And out of the 6 people that were there, 5 of us were CPAP users. And we were all in our 50s and, or late 50s. And we're wondering, jeepers, we should have been, how come we didn't know this before? And our conversations became somewhat of like a support group to a certain extent. So it was quite interesting, the conversation. So it tells you that the subject and the problem is probably more widespread than we know. For me, look, it's very simple. I mean, I think Dawn shared some experiences, and when you're not sleeping well, you're waking up early, when you're stopping to breathe and whatnot, even when your spouse is telling you, giving you hits, hey, wake up, sometimes that's still not enough for us to go seek treatment. So it wasn't until I was speaking with a neighbor that always tells me about it. Look, I'm a new man. I feel great. It's just like I'm 20 years old again and whatnot. And this gentleman was in his late 50s. And I said, well, maybe I better get tested. So not having a regular physician, I went to the Emerge and said, look, this is what's going on. This is what I need to, I need to see somebody for sure, because I'm not staying awake, trouble concentrating in the whole 9 yards and stopping breathing. And right away, prescription was done. I went to a respiratory therapist, and they set me up with a home kit. And it's not like it was, I would say 15, 20 years ago, where everybody had to go to the big city and go into this big sterile environment where you're hooked up, lights, and I don't know how they could really, do their work there. It's tough. They do it, I know, but for me, it was a take-home Holter monitor. So, and it worked very well, because once they got the results back, within a month, I had an appointment with a pneumologist. And when I got to see him, he looked at me with big eyes and says, did you drive here? Because it was a 4-hour drive. I said, yeah. I said, wow, I can't believe it. Why? Because like Dawn, I was on the severe level of sleep apnea, I think it was 79 times, disruption. So anyways, prescription in hand, he says, this is what you're going to need. You go to a service provider. He even gave me a list of the people who, sell these machines. So it wasn't a big, a scary outfit whatsoever. So I do, and again, you talk to other people. You talk about experiences. Where did you go? How did it? How was your service? So you do a little bit of research too, because it helps. So I go to the service provider, and okay, this is what we're going to set you up with. We got your prescription, the airflow, and the whole 9 yards. However, they said, this is the part I didn't like, is that you're going to be on a rental for 3 months. I said, what do you mean a rental? Well, it says the non-insured health benefits wants to see if you're compliant. So I didn't think nothing of it, but, kind of a paternalistic view of, of this treatment. So I take my machine home and get set up, and well, lo and behold, I don't know if other users can say, but you don't get used to that in 2 days or 2 hours or one night. It took me quite some time to get used to it. And every time it kept rolling in my mind, are they going to, not purchase this machine for me because I don't know if I'm compliant enough. I kept it for 5 hours, 2 hours, trying to get used to it. And it took me at least 2 months before I got used to it. So that was an added stress I don't think we really need. But because of that, I made a call. I phoned the regional office. I say, look, I know you have that word to see if the client is compliant. I said, by a true honesty, how many people have been refused this machine because of that? And this young lady at the NHB office says, to my recollection, nobody. Well, maybe perhaps take it off, so we don't have that added stress as, are we doing the right thing? It's 5 hours, 6 hours, take it off. Maybe time to review a few of those policies. So anyways, other than that, there's no problem. The machine was working well. And some of the do's I want to talk about is that just because you're given a machine and you're set up and okay, now you're getting used to it and whatnot, you got to make sure that you change your consumables, every 6 months, your hoses, your masks, whatnot, very important. Your filters, you change that on a regular basis. After 5 years, you can get a new machine, but also talk to your respiratory therapist, because even once a year, give a call and say, look, how's my thing recording? Because all the machines have a device now. It's like a SD card or whatever, and they're Wi-Fi. You can have the technician look at it. Yes, your things are going well. You're in the scope of the pressures. They're working well. So it's a good idea to stay in touch with your therapist, not just see them after 5 years. The other thing, because of that, you'll need to perhaps upgrade your mask, or maybe things change. You lost weight, gained weight, whatever. Sometimes you may need a new mask, or there's new masks that could become available. So that's why, after a couple of years, make sure you have an appointment with your respiratory therapist. It's important. The other thing I'd like to say is that, we have I think Dr. King has said it well, there's some responsibility, there's some ownership that we have to take. We need to be aware that we're in control of our own health, and that we need to step up to the plate to try to remove this stigma. But from a health director perspective in the community, we need to promote and advocate and bring awareness to this problem, because it's more prevalent than we know. We have an obligation, but we tend to steer away from that because we get used to working with diabetes, heart disease, and all those things that we've been geared to do for the last 15, 20 years. But all these side things and a lot of these diseases and conditions, probably some of them stem from a lack of sleep and sleep deprivation. So I think from our health center's perspective, we need to do more of awareness. When I was first diagnosed, for sure, that following year, we made pamphlets and got it all out. But after that, we got back into the routine that it was not part of our health plan. We kind of forgot about it. So I really appreciate the invite to talk about this. It's important. The system is not that difficult to navigate. I just wish that, the words compliance and stuff like that is not there. The fact that we need a justification to have a heated tube. I think, having quality air and the right to have good breathing is justification enough. I don't think we need to have an extra prescription to, okay, this gentleman should have a heated tube, because we're not all in tempered homes that everything is good. Sometimes your home is heated with firewood and whatnot. Temperatures drop, and so having a constant heated tube is another important thing. So That's all I can say about this. I mean, thank you, Don, for being brave and coming out and talking about this. This is something that is important to exchange, and it's not because if we have a few extra pounds or a football neck that we're going to get it, because I know a lot of slim folks too have sleep apnea and whatnot. So it's we got to get that awareness out. Thank you.
David, thank you so much for sharing that. And I think David and Dawn and myself, I think we were all diagnosed around the same time, because I remember us chatting about it and what are the chances that all three of us would have sleep apnea? And I have to say, those were great comments as well about, keep that relationship going with your service provider. I recently lost some weight and I still have to use my CPAP, but you never know where you might be navigating towards, and they can accommodate with a new fitting. All really good, relevant information. And Terry, Lee, and Denise, thank you for tuning in and being with us as we unpack sleep apnea. So I am going to shoot in a couple of questions for our guests today. And the first one is actually going to go to Dawn. Dawn, come on back into the crow's nest, because people, they want an update. You were so courageous in sharing that very intimate story. How are you doing now, Dawn?
Well, doing really good. Business is really good. With me, it was a little different. It took me 2 years to get the mask right. It kept coming off at night. I think it was averaging around 4 hours a night, which is torture. Like it just is. One of our staff here, he's a cyclist, a competitive cyclist, and suggested I stop eating around 7 at night, and just like that, it fixed itself. I was able to keep the mask on all night, and it was, yeah, it's just life's great. Quite happy with the way things look now. So everyone out there, the 87,500 hours, it's a real thing. Let's close that gap. Thanks for doing this, Marion.
Well, thank you for sharing your story, Dawn. Dr. Adams, as our family physician on the show, I'm wondering if you would like to chime in with some final thoughts after hearing what our guests have been saying. Did you want to just chime in with some words as well, Dr. Adams?
Well, I find it really moving to hear from patients, well, to hear from people who are affected, and definitely apnea is, in my community and in my family, and I know it's quite disruptive. It's quite something to live with. If you can imagine having your airways obstructed many times a night and waking up choking or with this sensation of trying to get out of your sleep so you can start breathing again, and it really has some total body effects, like around your blood pressure and your heart and your wakefulness, your energy, your mood. And I was really glad to hear us talk about it in many different ways. As in, we should have, for instance, the resources to get, say, a CPAP machine. We should be able to get that easily to help us. And we should have good access to other kinds of treatment, and we should have good access to diagnosis. Often as a family doctor, when I would see patients, we would talk about weight loss as, let's see what happens if you lose 15 pounds, because it's possible to cure sleep apnea, or to reduce smoking or drinking. And so those were always really careful conversations, because you do care about people getting well. You can imagine speaking to, say, your sister about this and saying, I really want you to get better. Can we try that to see if you feel better, to see if your apnea gets better, reduce the strain on your heart, and help you feel better. And I'm surprised how many patients would, and I was surprised how sometimes bringing that up would make people feel bad. It would make them feel, in a way, you would increase their suffering. So it is important for us to learn to be able to talk about making changes, being well. I always tell people we can always go back to basics: good food, good exercise, reducing the smoking and drinking. Those are all things that we all need to kind of come back to all the time, and try and make things better for us and our families. So those are just some thoughts, and I hope that that's helpful to people. And it's interesting being when I was a young doctor, and hearing about apnea, I was like quite shocked. I thought that happens, and now as an older man, not even just as a doctor, lots of my friends and family are affected by sleep apnea, for sure.
Thank you so much, Dr. Adams. I really appreciate that. And I'm actually going to go and give the final comment to David McLaren. Come back on in and give us that final.
Thank you, Marion. Anyways, really appreciate the work you've done here for our info. It's information sharing. It's unbelievable. One last thought, from a non-isolated community, we do have accesses to certain clinics in a relative, short period of time. Perhaps there should be some strong thought process around providing our nursing stations in more remote communities with these Holter machines. I mean, it's not rocket science to put these things on and get them set up. So that would probably help a lot of, get some diagnosis, up and running, because really it's not complicated. And I think it's something that we should seriously look at. Thank you.
I appreciate that. And to all of our panelists today, thank you so much for bringing this topic to our attention, for sharing your wise, wonderful practices, and for advocating for those members of your nations who can breathe better at night. Every breath counts. So do yourself a favor. Go get tested if this is something you think you are concerned about, and get back not just hours, but quality hours. And with that, thank you for watching the FNHMA Town Hall. Until next week, stay safe, stay healthy, and hi.